In this film, we're going to look at how to provide a safe, successful workplace flu vaccination service. Flu vaccination provides valuable health protection for you, your colleagues, your staff, and your business. We've been doing it for more than 20 years, vaccinating tens of thousands of people. Every year we get hundreds of inquiries about flu vaccination, but while every one of them wants to know about the cost, not enough people ask about the quality of service. To help you identify a high-quality provider, there's a checklist of important things to ask about on our website. For example, what kind of professional indemnity and insurance is in place? Will only registered nurses be used to give the vaccines? What kind of training have they had? Is there a formal quality assurance program in place? Who's in overall charge? Do they have premises that you can visit to inspect things for yourself? And what do they all do for the rest of the year? Flu vaccination is actually a complex medical service, so it's important to try to get a sense of how long the provider has been in business, how professional they are, who their other clients are, and what kind of feedback they receive. The vaccination session needs careful planning. To help things go smoothly, it's good to have a medical helpline to resolve any questions your staff may have in advance. Your provider should also offer plenty of administrative support. On the practical side, you'll need to provide a private room where confidential medical history can be discussed and where any restrictive clothing can be removed to give access to the outer arm. A first aid room would be ideal, or a meeting room with sufficient privacy. We'll also need 2 chairs, a desk, a phone in case of emergency, and hand washing facilities. Emma is one of our most experienced vaccine nurses, and she's going to explain what to expect when we arrive on site.
We provide a medical questionnaire so that we can quickly flag up things that might prove a problem, including allergies to anything that might be present in the vaccine, such as antibiotics, chicken, and egg protein. I look at the questionnaire, ask any additional medical questions, and document the answers in the medical record. I'll also respond to any questions the person I'm vaccinating may have at the time. We always bring along everything required to treat a severe allergic reaction, but the aim is to prevent it from happening. We bring a choice of different vaccine types so we can find the one that's suitable for almost everyone. We always arrive with our vaccines in a cool bag as they need to be maintained at the correct temperature range. Our vaccines come in pre-filled single-use syringes and are discarded immediately after use into a clinical waste bin. It is the provider's responsibility to take this away at the end of the session and dispose of it safely. Flu vaccines are given in the outer arm over the deltoid muscle. Anywhere else would not be good practice.
Thanks, Emma. That was perfect. Thank you. Michelle is one of our senior admin team responsible for arranging every detail of the service our clients receive.
It's not just about knowing how to give an injection. Your flu vaccination nurse should be able to answer any questions you or your staff have on the day and advise accordingly. Each individual needs to give informed consent before they can be vaccinated. That's why it's so important to have an experienced, well-informed nursing team with full medical backup. After your vaccination service is completed, your provider should collect feedback as a matter of routine, as well as providing contact information for aftercare service in case of any concerns. A full checklist of best practice can be found on our website.
The Fleet Street Clinic and flujabs.org have been called in to troubleshoot a number of incidents where flu vaccination arrangements made by other providers have gone badly wrong, leading to distress among employees, costly and time-consuming efforts to put things right, and in some cases to litigation. The best and safest option is to get things right first time.